This webinar was supported by an educational grant from HealthMark. Hello, I'm Corey Ofstead, and I'm an epidemiologist with a team that specializes in designing and conducting real-world studies to help support improvements in patient safety and occupational health. I'm here today to talk about innovations in training for sterile processing, which focuses on an educational framework for teaching complex skills. Many of us share the view that sterile processing is the heart of the hospital, the foundation for infection prevention and safety for both patients and healthcare personnel. To maintain this high level of performance 24/7, 365 days a year, sterile processing professionals are supposed to receive training and competency testing at least annually. But we're finding that occasional in-services and these annual competency testing are not enough to ensure that staff have all the skills they need. This isn't like going to college, where students can pick classes that are interesting to them or that they think are going to be easy. And they generally pass their exams if they get 60% correct, which is a D. And if they get a whole bunch of C's and D's, they still get a degree at the end, right? So, is this model relevant for sterile processing technicians? So what would happen if a tray came down from the OR looking like this, and the technicians only knew how to clean and prepare 60% of the instruments? Would you end up with a tray of instruments that are all tidy and organized like this, so that when it goes up to the OR, everything is for sure perfect and safe? No, right? And what do they expect up in the OR? They expect 100%, 100% every time, so every patient gets instruments that are perfectly clean and sterilized. We realize that effective training programs are super important after AAMI released new standards saying that endoscopes should be inspected using lighted magnification and mentioning that borescopes could be used to inspect channels. Now, the AAMI standards said that techs should be trained to identify damage and soil in scopes, but there were no training programs out there to help get them up to speed on how to do this. Now, we had done a survey that found gaps in training and practices in the field. In fact, we learned that most techs receive little to no training on endoscopes before they're expected to process them, and only about 1/3 of them were doing visual inspection at the time of the survey. So we developed a new program that covered key topics like guidelines and standards, endoscope anatomy, tools and methods that can be used for visual inspection, including borescopes and magnification, and common defects found in scopes, so that the techs would know how to assess risk and determine if some of the instruments needed to be recleaned or sent for repair. This program also covered documenting and communicating about findings of visual inspection, and to help support managers who need more resources, we included a module on that. Our goals for this program included ensuring mastery of key skills. And we also wanted learners to develop confidence, because it's super important for them to be certain that they know the content well, so that they don't waver or back down whenever there might be time pressures, which is like all the time, right? Or if a very strong personality, like maybe a doctor or nurse, is pushing them to go faster. Another goal was to help support retention or long-term durability of these skills, because we want the techs to remember it and know how to do it 100% correct all the time, right? So what's the secret sauce for doing a program that's going to be this effective? Well, we reviewed a whole bunch of studies to find out what optimized the outcomes for training for adult learners. And we put together something with some of these best components. One of the most surprising things we learned is that testing isn't just valuable for evaluation after the training. A pre-test given before the training can offer all kinds of benefits. For example, it can help engage the learners when the questions flag content that's really important for them to know. It can also alert instructors about gaps in what the learners know and don't know. If they do really poorly on a pretest, we want to reassure them that that's okay because we haven't done the training yet. Now, post-test can offer benefits including evaluating knowledge, of course, but they can also help cement learning when the students see questions on topics they just learned about and it reinforces it. And if they do super well, they get that little emotional celebration, and that can improve their confidence level. A good post-test can also help the instructors learn what worked and maybe what they need to improve in their training program. And lastly, frequent retesting can help with retention over time. So we developed a program that started with a pretest and a survey that covered knowledge, confidence levels, and satisfaction with the training program. To optimize the outcomes for the training for learners who have different learning styles, the workshop included lectures, demos, hands-on practice, group exercises, and presentations by the trainees before they completed a post-test that repeated the knowledge, confidence, and satisfaction questions. We also assigned homework so the trainees would go back to their facilities and practice their new skills right away. They each inspected at least 10 endoscopes and documented their findings using a log sheet we provided. They also assessed risk to determine if any endoscopes needed to be re-cleaned or sent out for repair. And they shared their findings with their internal stakeholders and sent them to us so we could confirm that they had indeed gained the skills in visual inspection and documentation. A couple of months after the workshop and their homework, we held a Zoom training, which was a 3-hour course where we provided a refresher on key information, and we reviewed examples of the photos and defects found by the trainees in their own facilities. This allowed them to expand their awareness of things that they might find when they do visual inspection. Then the group talked about it all, and we kind of reaffirmed the findings and the importance of various aspects of this. And we wrapped it up with, guess what? Another test. And this test again covered the knowledge, confidence, and satisfaction with training. And it didn't end there. The trainees also completed another test 9 months after the workshop, and again 12 months after the initial workshop. After all that, we presented the findings to the trainees, the sponsors, and other HSPA stakeholders, and we prepared papers for publication of the findings. The results were published in the American Journal of Infection Control and in Process magazine. You can get a free copy of the AJIC article by clicking on the link below, and you can get a copy of the Process magazine article from HSPA if you're a member on their website. And if you're not a member, I strongly recommend you consider joining because it's a fantastic opportunity to get their magazine and other resources from HSPA. Now let's unpack some of the details about the training program. First, we developed a super intense test that included 78 questions. Now, here's a couple of examples to show you how we worded and formatted some of the multiple choice questions. Now, you may notice that most of them had a not sure option. And this is there so that the trainees wouldn't just guess if they didn't know the answer, because then we wouldn't know if they really knew it or if they just got lucky. And we wanted an accurate sense of how much they knew. The test also included a whole bunch of items that were skill-based and practical. And they look like this. The first question up here is, what component is this arrow pointing at? And we had a question that said, what are the grooves on the end of this scope for? Or this one that said, what's wrong with this scope? And they had to identify the defect. Or what are these dangling filaments in the channel? These questions were designed to be tough, and anyone without extensive training was expected to do poorly before they learned all the details in our training program. So now we have a training program and a rigorous test. But what about trainees to help us evaluate its effectiveness? Well, we worked with HSPA to recruit members who were CRCST certified and came from diverse geographies and types of facilities, but did not already have the skills that they would have gotten if they were certified in endoscopy or they'd already been trained on borescope exams. They had to be willing to participate in both the training and in being evaluated for a whole year, and they had to have support from their managers for the training and other activities. We gathered all the trainees together at our headquarters, and we did a pretest, and then Abby Smart started out by doing a lecture on endoscope anatomy. COVID was still a factor when we met face-to-face, so we all masked up. We interspersed lectures and demos with hands-on training led by experienced coaches, including Damian Berg from HSPA, Frank Daniels from VCU, Abby Smart, and myself. The trainees took turns using the borescopes and magnification systems to inspect urology scopes, bronchoscopes, and a variety of GI scopes. There were some group activities where we all gathered around to look at some defects identified by the trainees. And boy, some of our training scopes had doozies for defects. After a few rounds of lectures and hands-on practice, the trainees worked in small groups to inspect a bunch of scopes and prepare reports that they shared with the group. This allowed them to practice documenting their findings and sharing what they saw with other stakeholders, so they'd be well prepared to do this when they returned to their facilities and started inspecting scopes. The trainees submitted their homework assignments so we could confirm that they were capable of performing the inspections and documenting the results. This is an example of a log sheet for a gastroscope that was submitted by one of the trainees. They noted that there were minor superficial scratches around the biopsy port, moisture visible in the biopsy channel, and filamentous debris in the bending section near the distal end of the insertion tube. One of the trainees discovered a gastroscope channel that had some milky white droplets of fluid like this, and some black spots that looked like soil, and odd markings that looked like there was a shadow or maybe a residue of something in the channel, as well as a huge droplet or puddle that stretched all the way across the channel and looked kind of like saran wrap. This gastroscope had a gooey, jelly-like substance underneath the knobs on the control handle. Can you see it right here? Oh. And this colonoscope had a brown blob in the channel, while this one had a bunch of black gunk in there. They found all kinds of other defects too. This is an EUS scope with a fragile ultrasound probe on the distal end of the insertion tube. It's used for upper GI procedures. Now, when our trainee looked at the distal end, in this area marked with orange, they saw this. Whoa, what's all that black glop? And there was also residue on the elevator wire here. So this opened up some very interesting conversations with the reprocessing team and also with the manufacturer about the cleanability of this instrument. But this one wins the prize. This is a pediatric bronchoscope that was fully processed and hanging in the cabinet ready for a procedure. Now look at it. The adhesive band that holds the bending section onto the insertion tube was just gone. Look at this. It's got all kinds of jagged edges that could tear the patient on the way into their lung. So at the end of the day, all of our trainees did their homework, and all of them found scopes that needed to be re-cleaned or repaired. In addition, one of the techs found a lot of fluid inside scopes that were hanging in cabinets, and this led to new policies in their facility about drying. At the end of the day, technicians who received this comprehensive training program in visual inspection discovered scopes with serious defects in every single institution, which shows that training can have clinically relevant impacts. A couple of months after the initial workshop, we convened a Zoom training session with most of the trainees, and we showed them some of the photos that the trainees had submitted showing a whole variety of different kinds of defects. We also gave them a refresher on endoscope anatomy, identification of defects, and standards for inspecting scopes. And we wrapped it up by testing them again. And then, as I mentioned earlier, they got tested 9 months and 12 months after the initial workshop for a total of 5 tests in a year. So let's take a look at the results of this training program. We set the passing score at 70% because that's equivalent to a C score. But you already know I don't think that's good enough for sterile processing. In any case, the average score was only 46% on the pretest that they completed before the training. Now remember, they had not had any exposure to training on using borescopes or magnification to inspect endoscopes. So we didn't expect them to be well versed and do great on that test. Now after the workshop, the average score is 86%, and things actually looked even better after we did that refresher and group activity on Zoom. Then the results held steady at 9 months and out to 12 months. We're slipping a little bit, but I'm going to show you something else that's really exciting. If we look at the data another way, there's a bar for each of the trainees, and they're numbered 001 to 009. You can see that everyone's scores were way below that 70% benchmark before the training. And trainees number 1 and 3 did better than the others. But by the time after the workshop, everybody's scores went way up. And some of the trainees actually did better than the 2 who had scored the best on the pretest. Now, everyone's scores stayed way above the passing level after the homework, and they remained high for the whole year after that initial workshop. Now, you may have noticed that there's a couple bars missing over at the 9-month and 12-month, and that's because some of the employees left their positions or they weren't able to attend when we did the testing. Now, let's look at the data for various skills related to visual inspection and risk assessment, like recognizing scope components, using a borescope and magnification, identifying defects, assessing risk, etc. Now we set the goal at 3 on a scale that went from 1 to 4, with 4 being very confident. Before the workshop, we asked them how confident they were with skills based on previous training they may have received, and the numbers were fairly low. And here's how they rated things after that initial workshop. Confidence went way up. And we were delighted to see that their confidence levels stayed up through the whole course of a year after that initial training. Again, we think this shows the benefit of supplementing an initial training with homework for practice, a refresher course, and repeated tests throughout the year. Now to wrap up, what's the secret sauce for optimizing training for sterile processing professionals and others working in healthcare? Well, it starts with pre-tests that optimize engagement of your learners, and then taking the reading and lectures and supplementing them with demos and hands-on activities and homework, and doing post-tests that are going to both cement the learning and allow you to evaluate the learning mastery. Then refreshers are necessary to reinforce key information and fill gaps, and we wrap up with practice and repeated testing afterwards to optimize the skills and confidence and their retention. At the end of the day, we concluded that this approach to training was successful in achieving mastery and confidence, long-term retention of knowledge and skills, and clinical relevance, since the trainees were all able to identify defects in endoscopes that were supposedly ready for patient care, and they identified risks and made sure the issues were addressed to improve patient safety. Thank you for joining me for this YouTube video. Now, my team made a couple of handouts that you might find useful. This one includes a crosswalk for studies that have found that pre-tests, hands-on training, and refreshers, along with repeat testing, can have a positive impact on training outcomes. And this one summarizes key elements of a training program that can help you optimize the effectiveness. You can download these handouts on our educational portal, and there are links below. We also have several other YouTube videos and CE courses that cover some of the content that we used in our workshop and the subsequent training on visual inspection. Be happy for you to go get them. It's all free. If you're someone who likes to read scientific studies, Here's a list of references for several papers that cover topics related to visual inspection. Thanks for watching this video, and I hope you were able to take away some things that will help you improve your training for sterile processing professionals.